I'm sitting down with Dr. Mario Raviglione. He's the director of the Global TB Program at the World Health Organization. Now, Doctor, tell us, what is the World Health Organization focusing on this year when it comes to TB?
This is the year of the end of the Millennium Development Goal era. So the focus here is now on the transition between the Millennium Development Goal era and the Sustainable Development Goal era that will begin in January. So what we are doing now essentially is to sort of take stock of what happened in the last 15 years with good and bad news, and then see really what can be done and must be done starting in January 2016.
Now we're talking about Sustainable Development Goals. What can we expect to start seeing come January?
The Sustainable Development Goals really require a mindset change. You know, we have to shift from the concept of halting or stopping tuberculosis, because it was going up before, right? Now it's going down, although very slowly. So we have to shift from that type of situation to a new type of situation where we are really targeting now ending the epidemic. So that requires modifications in the way we do things. Requires actually some time, a real shift of our mind to go towards what can be done on top of what we are doing already that will accelerate the decline of both cases and deaths of TB, with a very ambitious targets in 2030 to get incidence down by 80% and mortality down by 90%.
Tell me about those modifications.
All right, so the new NTB strategy is based on 3 pillars and 4 basic principles. So the principles are those of engagement of community much more than it has been so far, under the stewardship, of course, of the government that has to really drive the national program type of activities. It requires much more sensitivity to the concept of equity, of gender, of human rights. It requires also the engagement of the private sector. So these are basic principles, but the substance in the end is in 3 pillars. The first one includes all the possible innovations we have available today to deliver proper care to people. The second pillar includes all the adjustment in the system and the policies that we need in order to be able to deliver good TB care and TB cure in the end outcomes. And starting with basically the concept of universal health coverage and the concept of social protection. And the third pillar is that on research. Without new tools, we are not going to accelerate in a much faster way.
Now you mentioned healthcare, and I know a lot of the people who suffer from tuberculosis are usually in impoverished areas, underdeveloped areas. How are we going to get the proper healthcare to these people?
So the first step in the NTB strategy now that we are promoting is that of mapping the epidemic. That's what we are telling countries to do now. So it's time really to look into your epidemic, decide where the vulnerable people are, and target those populations in a much more intensive way, starting with much earlier case detection. So we want to really get the patients before they become sufferers of TB, at the very beginning of their disease. And we want to provide prophylaxis. These are new things that are on top of the basics that remain extremely valid and fundamental, the basic being that you have to make a diagnosis in a certain way, you have to treat in a certain way, and you have to monitor what you're doing.
Currently, do you think there are enough healthcare providers in these areas to implement these changes that we were just speaking about?
In some countries there are, in some others there aren't. You know, I was recently in one of the African countries, Ethiopia for instance, that has an excellent primary care system that goes down to the community, because they have developed this primary care system beyond tuberculosis that will also contribute to tuberculosis care. They have 40,000 women that have been trained in villages, in rural areas. They call them health extension workers. So that is a sort of model that we want to follow and have in every other country. I give you just that example. There are other countries that have this type of things, but there are also countries that do not have this type of thing, and that's where the primary care level, the primary care work has to start and really intensify in such a way that then the delivery of the TB care, which is more specific, can take place. Without that type of intervention, is going to be very difficult.
Now the goal is to end TB by 2030, am I correct?
Correct.
Do you think we can meet that goal?
I think that if we really implement everything we have available today, number one. Number two, we address the issue of universal health coverage and social protection, which are fundamental to avoid impoverishment of already very poor people. If we have new tools that will come in the next few years, like a diagnostic that can be used at the point of care, or like a new regimen that shortens the treatment duration, therefore making it more feasible, more approachable. If we eventually have a vaccine vaccine. All of this together will allow us to reach the 2030 targets.
Mario, thank you very much for sitting down with me.
Thank you.